In this video today, I'm going to tell you exactly how a real doctor treats fatty liver disease. If you have fatty liver disease, or if you're wondering how to exactly treat this and what is the best evidence behind this is the video for you. Let us begin. So for those guys who are joining me for the first time, my name is Dr. Samir Salman, and yes, I am your poop guru, and my passion is to give you guys tips and tricks to help out with your gut health. If you're new to these video series, I do a lot of videos on educational videos, GI videos, product reviews, and videos to help explain certain conditions. And if at any point in time during the show notes, click down below. I have a lot more information on these videos. And before we begin, don't forget to hit the like button, follow me, so you can get more information on what's about some of the videos that I talk about today and some of the videos I've talked about in the past. Now, in this video, I'll tell you exactly how me as a GI doctor helps to treat somebody who has fatty liver disease. So if you suffer from fatty liver disease, or if you know somebody who has this is the video for you. Before we begin, comment down below, let me know, have you guys been diagnosed with fatty liver disease? How are you diagnosed with fatty liver disease? And are you interested in learning more about what we can do to help out with your fatty liver disease? Make sure you comment down below so I know exactly what you guys think. But when it comes to fatty liver disease, as an overview, keep in mind that fatty liver disease is an accumulation of fat in the liver from any number of different conditions, whether it's from obesity, lifestyle, sometimes even alcohol. If you have certain conditions like diabetes or problems with your lipids, this is most likely setting you up to develop fatty liver disease. And the issue with this particular condition is that the long-term complications from having fat in your liver can be very, very bad, including the risk of developing what's called liver cirrhosis or end-stage liver disease, or even liver cancer as well. And a lot of people don't realize that they actually have this accumulation of the fat in the liver, and more often than not, I have people who come to see me who have flat-out cirrhosis without realizing that over the past couple of years, they've had an accumulation of fat that over time causes inflammation, scarring the liver, and leading to liver failure. So my job is to make sure that, number one, you're aware of this, but also number two, if you have this condition, what can we do to help treat this, prevent this from having long-term complications for you? Now, if you have some of the risk factors like diabetes, obesity, problems with your cholesterol, or even problems with medications, this can lead you to have fatty liver disease. So if you have these conditions, this may be the video for you to help us see what we can do to treat this. And the issue when it comes to fatty liver disease is the fact that the symptoms typically are not there. So you may actually have fatty liver disease, or you may be setting yourself up for this condition, but you don't actually realize that the symptoms that you have may be causing you problems. Comment down below, let me know if this is a scenario for you. And let me know if you didn't even realize that you had fatty liver disease, and all of a sudden your doctor told you that you had this particular condition. So now that we have this, how do we diagnose this? A couple of ways we can diagnose this: blood testing, imaging, and for some people we actually may need to do a liver biopsy. I'll put a link for more videos about how we diagnose fatty liver disease. Now, let's get to the crux of the matter. You have this condition, you know somebody who does, or you have some of the comorbid complications, diabetes, heart failure, maybe a problem with your lipids. How do we treat this particular condition? Now, before I begin, make sure that you speak to your healthcare provider before you implement any type of medical changes or treatment. Don't do this on your own. Don't say the Dr. Islam told you to do this. Make sure you speak to your healthcare provider about what options you can do for treatment and whether you should actually start a treatment condition to hopefully help out with your fatty liver disease. It's very easy to have this discussion with your healthcare provider. So it is very difficult sometimes to treat the condition because we actually don't treat the fatty liver disease itself in the liver. We actually treat the conditions that are associated with fatty liver disease. These include things like diabetes. So if you have diabetes, we may have to put you on medications to treat the diabetes, whether it's insulin or whether it's oral medications. And this indirectly, by treating your diabetes, will also treat your fatty liver disease as well. If you have heart disease, we may treat you for this. So if we're treating your heart disease, or if you have heart failure, you have stents, we treat that condition. And by treating that condition, we also in turn treat your fatty liver disease. If you have problems with high blood pressure, this is setting you up for developing fatty liver disease. So we treat your high blood pressure, whether it's with diet, exercise, or medications. And by doing that, we also treat your fatty liver disease at the same time. And also, if you have high cholesterol, we're treating that condition whether it's medications, exercise, or diet. And by treating that condition, you're indirectly treating fatty liver disease. So we're not actually treating the fatty liver disease itself, but more often than not, we treat the associated conditions with that. And by treating that condition, we're indirectly controlling your fatty liver disease, and we're hopefully controlling some of the symptoms that can occur with that and some of the long-term complications from that as well. But I will tell you that weight loss is a very effective option when it comes to fatty liver disease. It's probably one of the best things that you can do. So even if you lose just a little bit of weight, I'm not asking you to lose 30 or 40 or 50 pounds, so if you do, that'd be great, but even if you lose a little bit of weight, that will provide you a tremendous amount of benefit for your fatty liver disease. I'll put a link about some of my recommendations for how to do with weight loss. Now, when it comes to what diet to put patients on, a lot of people ask me this particular question. I will tell you there's no one particular diet that's been shown in clinical trials to be the best diet. A lot of diets work, but the best diet overall when it comes to weight loss is what's called a hypocaloric diet, meaning you actually measure your calories. You see how many calories you need per day, and you decrease the amount of calories that you intake. By far, no matter what diet that you do, whether it's paleo, Whole30, gluten-free, keto, all of the consistent findings from those diets is not the particular diet itself, but the fact that you're taking in more calories than what you need. And that is probably the best way to lose weight. So it involves tracking, keeping track of your food, knowing exactly what goes in, what goes out, using some sort of app to help out with the tracking of the amount of calories. It doesn't matter what diet that you do. There's not one diet that's going to say, hey, this is the best diet. But I will tell you, all the diets combined, when it comes to fatty liver disease, the most effective diet is a hypocaloric diet, meaning it is a diet that is less in terms of calories than what you normally would take. This by far is probably the best diet. The second thing you have to do is exercise. So even if you exercise and you don't lose any weight whatsoever, the physical act of getting out and doing physical activity, whether it's a brisk walk, jogging, maybe parking far away so you can walk more, the physical act of exercise causes inflammation to go down, causes the oxidative problems to go down, and really decreases the amount of inflammation in your liver. So even if you exercise but you don't lose weight, the physical act of getting about, moving around, and trying to exercise will decrease the amount of inflammation in your liver by far. So do what you can to get out, even if it's just a little bit. Just start off and seeing how you do, because I can tell you you're going to decrease the amount of inflammation by doing that. So if you have high blood pressure, treat this as well. If you have high cholesterol, we treat this as well. And if you have other conditions, we treat that as well. Now, there are some patients, not everyone, in which we recommend vitamin E. There are some clinical trials in which suggest that vitamin E can help out with fatty liver disease in certain individuals, but not for everyone, because there are some long-term complications with vitamin E in certain people. There is a higher risk for causing all-cause death, and for some people, there's a higher risk of developing prostate cancer as well. So before you try to implement vitamin E in your diet, talk to your healthcare provider about whether you should be on vitamin E or not for your fatty liver disease. So make sure you don't try to take this on your own. But there's been some clinical trials to suggest this can help out with people who have inflammation in the liver. And then coffee. Now, people don't realize this, but coffee has been shown to have a tremendous amount of antioxidant effects on your liver. There's a lot of benefit with coffee. Now, when I specify coffee, a lot of people assume that the coffee they get from Starbucks is the coffee that I mean. Don't do that, all right? It's not coffee filled with sugar, filled with cream, filled with whipped cream, filled with milk. That is not the coffee that I'm talking about. Straight up black coffee. Whether it's decaf or caffeinated, it does not matter, but black coffee has been shown to decrease inflammation in the liver. It's a very natural, effective way to help treat fatty liver disease. So if you drink coffee, continue drinking it. If you don't drink coffee, you want to try and start that. That is a very effective, natural way to treat your fatty liver disease. But keep in mind, it's not the yummy coffee that we get from Starbucks. It is black coffee alone. And whether it's caffeinated or decaf, it makes no difference. But this is actually one of the things that I recommend for my patients to help out with their fatty liver disease, especially for a natural way to treat their particular condition. So in summary, weight loss and exercise by far is the most effective way to treat fatty liver disease. There's no magic pill that I can give you that's going to tell me, hey, this is going to fix your fatty liver disease. Diet and exercise are probably the most natural and the best way to help decrease the amount of inflammation. If you have a hypocaloric diet, that's the best diet, and any type of exercise, whether it's a little bit or a lot, will help decrease the amount of inflammation. And also we treat the underlying condition, whether you have heart disease, diabetes, problem with your blood pressure, or maybe problems with your cholesterol. We treat these. By treating this will indirectly treat your fatty liver disease as well. Coming up, I'm going to talk to you about what are the diet recommendations that I recommend for my patients who have fatty liver disease. Now, I know I told you there's no specific diet that I recommend, but there are certain foods that I will tell my patients to eliminate. By eliminating these foods, I've had a lot of good success in terms of decreasing the amount of inflammation in the liver. So stay tuned for future videos on this. I want to thank you guys for joining today. My question for you is, how did you treat your fatty liver disease? What did you do to help fix the inflammation? What recommendations do you have for my audience and for me? Comment down below. I'd love to hear what you guys had to recommend, what you guys have done to help decrease the amount of inflammation. Have you found some of these recommendations helpful as well? Let me know down below. I want to thank you guys for joining me today. Don't forget to subscribe, click the like button, follow me, and every Tuesday I do my Facebook Live, and every Thursday I do my Poop Tip Thursday. Don't forget to join me on those days. And thank you guys for watching this video. I look forward to seeing you guys on more videos. Thanks and take care. I want to thank you guys for watching this video. Don't forget to click here for more videos. And if you want to learn more about fatty liver disease, don't forget to click here. Thanks and take care, guys. Coffee. It's the way to do it. This is the way we treat fatty liver. Me and my coffee.